What if your voice, your very identity, suddenly turned into a whisper?
నోట్తో కలుసుకుని నోట్తో కలుసుకుని నోట్తో కలుసుకుని
Laryngeal cancer is a silent and deadly disease, affects over 1,77,000 people each year worldwide. Yet most even don't know where their larynx is. In India alone, laryngeal cancers make up about 2.4% of all cancers and it hits men over 50 the hardest. But here's what truly shocking. Over 60% of the cases are diagnosed at advanced stages, drastically reducing the chance of survival. Breakthrough treatments and early detection tools are changing the game. Before we begin, if you want to know anything about head and neck cancers, comment below and I will make a video on it. Laryngeal cancers begins in the tissues of the larynx, which houses your vocal cords. More than 95% of these cancers are squamous cell carcinomas. They are categorized anatomically into glottic cancers, which are 59%, and supraglottic 40% and subglottic less than 1% cases. Smoking is the number one risk factor linked to 85 to 95% of all cases. When combined with alcohol, the risk increases up to 100-fold. The disease affects 5 times more in men than women and typically strikes between age of 50 and 70. Early stage glottic cancers boast a 5-year survival rate above 85%, but for advanced supraglottic tumors, it drops below 50%. Diagnostics include flexible laryngoscopy to identify the tumor and mapping biopsy to confirm the malignancy. PET scan plays a critical role in detecting distant mets and recurrences. Currently, we follow AJCC 837 TNM staging, incorporating the depth of invasion. Treatment is stage dependent. Early glottic cancers are managed with radiation or transoral laser microsurgery, both yielding approximately 90% of cure. Transoral microsurgery is a procedure where carbon dioxide laser is used to help with a microscope to remove the cancer surgically without any cuts on the outside of the body. Advanced stage cancers, or when cancer has spread to the nodes, typically patients receive concurrent chemoradiotherapy, often with platinum based chemotherapy agents like cisplatin. Over 30% of the patients of chemotherapy radiation fails, in which salvage total laryngectomy is done. It's a surgery where complete removal of voice box is done, along with removal of neck nodes, and a permanent opening for breathing is made in the center of the neck. Recurrence rates ranges from 20 to 40%, mostly within 2 years post-treatment. Follow-up includes monthly laryngoscope in the first year and then 3 and 6 months. Now, what's new? Immunotherapy, especially PD-1 inhibitors like nivolumab and pembrolizumab, are showing real potential. They offer a better response rate in recurrent and metastatic cases and median survival up to 12 months. There is also a push for laryngeal preservation protocols using induction chemotherapy and response-based radiotherapy. Robotic-assisted transoral surgery, laser navigation systems, and even AI-powered voice analysis tools revolutionizing the outcome and detection. Laryngeal cancer is no longer a guaranteed death sentence or a guaranteed loss of voice. From robotic precision to immune target therapy, science is pushing boundaries. But awareness and early detection and diagnosis remains our strongest allies. If you smoke, drink heavily, or notice hoarseness of voice lasting over 2 weeks, get checked it now. Stay informed, stay loud, stay alive. If you want to know more about head and neck cancers, comment below. I'll make a video on that.